what made me decide to do LVI Core 1, I had actually taken another course. They talked about doing full mouth without having to prep the teeth. And I thought that was very interesting, and I really enjoyed that. And I came here and learned how they open bites, a physiologic bite other than a CR bite, and that really allows you to do things much more prepless and much more conservative, and it will still last a long time. Here at LVI, I've really felt like it's much more family-like. They're there to help you. You can reach out to any of the instructors at any time when you need anything. There's no gatekeeping, which sometimes we see that, in some courses where it's just, a bunch of slides basically showing how awesome I am, but then you go and implement those things and it doesn't ever quite look the same, or there seems like something's missing. But here I feel like you really get the full picture, so you can go back and implement and do the exact same things that the instructors are doing. In my practice, there were certain cases or specific patients that I would be much more cautious to do treatment on. They had a lot of issues. There were those red flag patients that you kind of want to avoid, whether there's pain or something else going on that's just a little bit more complex. And I didn't feel like I had the knowledge to be able to take that on, to get them to a really comfortable spot much faster. But now with LVI, I'm feeling much more confident to be able to tackle on, TMD patients, patients that have pain in the joint, other issues like vertigo, and things that I just never associated with the TMJ. So I'm pretty excited to implement this in practice. If you're considering starting your LVI journey, I would highly recommend it. Honestly, it will completely unravel most of the things you were taught in dentistry, which I love, and it really implements a lot of critical thinking. I feel like a lot of things you hear the same thing over and over, but just different verbiages, or it's very similar, but maybe one thing slightly different. This is just completely different, and I really feel like this can really help patients much better than a lot of the things I did in the past.